Hi, my name is Jenna Beilman. I'm a student nurse at Cedar Crest College, and today I'm going to be presenting on the effects of music therapy on anxiety of patients with breast cancer after a radical mastectomy, a randomized clinical trial. So the problem with this study is female patients who have undergone a radical mastectomy due to breast cancer are facing anxiety. And in China, the breast cancer rate is rising, as well as all over the world. And anxiety is actually found to be the greatest psychological symptom that breast cancer patients face. The problem's significance is that anxiety and stress can hinder the healing process, as well as lead to other psychological, psychosocial, and physiological symptoms. This consists of depression, isolation, nausea, vomiting. And researchers really wanted to come up with a way that was less invasive therapy for these clients since they undergo so much already with chemo and everything like that. So the study purpose, it was to evaluate the effects of music on patients after a radical mastectomy due to breast cancer. The researchers came up with two hypotheses. The first one being patients in the experimental group will have a reduced score of state anxiety in comparison with patients in the control group after music therapy. And the second one was that the treatment effect changes with follow-up time. The study design, the framework was designed based on a model by Linda E. Hall, which was called the Core, Care, and Cure model. The study was a randomized controlled clinical trial, so it did consist of a control group and an experimental group. The control group were patients with no access to music therapy, and the experimental group were patients with access to music therapy post-mastectomy. The independent variable was music therapy, while the dependent variable was patients facing anxiety. The sampling method, researchers recruited 120 female patients between the ages of 25 to 65 with pathological diagnoses of breast cancer with a radical mastectomy. They did split these groups up 60 and 60, which was done using a computer to randomize and generate the study groups. Researchers excluded patients who stated they were allergic to sound or had some sort of voice-sensitive epilepsy, or who simply stated that they preferred not to listen to music. And if we did allow those into the study, it could have had a negative impact on the trial. So the interventions and implementations, the experimental group was allowed to choose music genres during their therapy. This was a positive intervention because of the patients wanting to listen to their own music. It could have an increased desire effect on the study. The patients were also allowed to control the volume of their music, and therapy was twice a day. It was once in the morning and once at night. Still, the control group had no access to music therapy or any given knowledge about music therapy. The data collection and analysis, the study used the State Anxiety Inventory, which was called the SAI, and this was used like pre- and post-mastectomies. After radical mastectomies, SAI was conducted 3 times for a first post, second post, and third post. The results were analyzed by a t-test, which was used to ensure that the measurements of anxiety were comparable with each other. They also used a chi-square test, which that was used to statistically determine if the significance between demographic data had any effects on the results. Lastly, they used an Anikova test, which was used to determine the significance of the results. For the ethical components, Human Research Ethics Committee was the one who reviewed and approved this process. Participants were given information, except for the control group, because they were afraid that it would affect the trial. But overall, patients were given written consent to be in this trial. The study did have some limitations. Researchers only collected quantitative data. There was no subjective data collected by these patients. And the research only really focused on the psychological data. There was no feedback from patients on any psychological symptoms that we're receiving. And there was a small number of patients who actually went through a radical mastectomy. So for further studies, this may be some things that they would want to fix and tweak. But the results of this study was found that music therapy did reduce anxiety in these patients. For some nursing implications, using the Linda E. Hall's core care and cure model along with music therapy, this could be great to use in practice because nurses can use this as a complementary intervention due to it being so universal. And it really reduced anxiety levels, which when anxiety levels are reduced, you do get a better patient outcomes, which can increase healing time in these patients, which leads to shorter hospital stays, better patient satisfactory rates, better patient safety, etc. But in conclusion, music therapy is a great way to help reduce anxiety in patients with breast cancer who did undergo a radical mastectomy. Music therapy and the core care and cure model are great nursing tools that I think nurses can really benefit from. And just overall, music therapy is a great way to reduce anxiety and stress in these clients. And here is the list of my references.